Expectant mothers living in rural parts of Minnesota, like the Northland, access to maternity units is disappearing, forcing them to sometimes drive hundreds of miles to give birth. Northern News Now's Larissa Millis reports how one of Minnesota's senators is working to address the issue.
In less than a decade, more than 200 maternity units closed across the United States. Minnesota saw the biggest impact with 17 closures. That's all according to a study from healthcare consulting firm Chartis, which published that data in a recent report.
Rural obstetric unit losses are a big deal. We know that they're happening. We know that they've continued to happen for decades now.
Julia Interante is a research fellow at the University of Minnesota Rural Health Research Center. She says some reasons behind obstetric closures in rural communities include staffing and financing issues.
If your community happens to be a community where a lot more patients are on Medicaid, it can be harder to maintain those services because the reimbursement rates are so much lower.
Interante says the lack of maternity care in rural areas can lead to many issues like preterm births. Minnesota's U.S. Senator Tina Smith is working to address the problem.
There are a lot of moms in rural Minnesota, but the problem is many of them have to travel long distances to be able to deliver their babies.
Smith recently visited Cloquet Community Memorial Hospital to observe a live birthing simulation demonstration. She says it was important for her to secure funding to expand rural obstetric simulation training to help people in more rural communities like Grand Marais.
And it makes a huge difference because if you don't have to travel a long distance, you're much more likely to have good, healthy outcomes both for the moms as well as for the babies.
Smith believes better maternal care is important to improve communities overall.
Think about where people are deciding where they want to live, where they want to raise their families. Having access to good health care, and including maternity care, is really central to that.
In Duluth, Larissa Millis, Northern News Now.
Smith helped secure $520,000 in federal funding for that rural obstetric simulation training expansion, which she says will help healthcare providers keep up to date with skills in labor and delivery.